Staying on with Omicron. Now, the United States is approaching towards a new pandemic trend. The hospitalization of children is soaring to a record high. According to data released by US government on Friday, there has been a rise in hospitalizations among children under the age of 5. Now, this is the only group that is not eligible for vaccination. Speaking on which, the director of the Centers for Disease Control and Prevention said that the worrisome trend in children too young to be vaccinated underscores the need for older kids and adults to get their shots to protect those around them. Listen in.
While children still have the lowest rate of hospitalization of any group, pediatric hospitalizations are at the highest rate compared to any prior point in the pandemic. Sadly, we are seeing the rates of hospitalizations increasing for children 0 to 4, children who are not yet currently eligible for COVID-19 vaccination. We are still learning more about the severity of Omicron in children and whether these increases we are seeing in hospitalization reflect a greater burden of disease in the community or the lower rates of vaccination for these children under age 18.
Now, since mid-December, as the highly contagious Omicron variant has spread furiously around the country, with the United States reporting record single-day infections, the hospitalization rate in these youngest children has surged to more than 4 in 100,000 youngsters. This is up from 2.5%, 100,000. Now, the director further pointed out that some unknown number of these cases are incidental. Now, children who test positive when they're hospitalized for non-COVID reasons. Many of the case reports of children come from asymptomatic kids who went to the hospital for elective procedures or other illnesses, further complicating the picture for epidemiologists trying to figure out risks for kids. Now, earlier in a White House briefing, U.S. top infectious disease expert Dr. Anthony Fauci said many children hospitalized with COVID-19 have other health conditions that make them more susceptible to complications from the virus. Now, this includes obesity, diabetes, and lung disease.